Hello, welcome back to my channel. This is William speaking. As you can see, I put this iPhone on the top of this frame, and the angle is quite different from my previous videos because today I want to talk about a new concept that I contact the last several days. It is very important for myself. Um, and maybe you will think it is not so important to um, to 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 make this iPhone face towards other things, but that is actually very important for me because that means I will face towards this iPhone and I will face many other different things. Actually, I'm now facing towards the road itself. There will be some people passing by, and I personally will looking towards them. I will face towards them, and that is so important for me. That condition I will talk about that is so anxious for myself. I okay this concept that I contact these days is called Morita therapy. Morita therapy. If you are a psychological disorder patients, you will be not you will be not so you will be familiar with this concept. It is Morita therapy. Um, so, in fact, I had this condition for more than 20 years. The first day I had this condition is the grade 2 during my university. At that day, when I go to the restaurant, the the cafeteria in my university. And when I will buy a meal, I find that I can see very clearly through my peripheral sight. That is so weird for me at that time. And I feel so awkward because other people will notice that I'm watching them through my peripheral sight. So I try to control my peripheral from focusing on those people, and I feel so nervous. But that pushed me towards another direction. I will feel I I was focusing on them more 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 intensely. So that is my condition. Um, I had this condition for so many years, more than 20 years. Now I'm 44 years old, and when I first got this condition, I'm only 17 or 18. That is my second year in the university, and till that day on, this condition combines uh, com- uh, was with me for so many years. It never leave me even one day, and and till the last several weekends, I talked with AI about my heart surgery, and then I mentioned my anxiety and talked about this condition. And AI told me it is a disease. It is a psychological disease, and it has its own name called peripheral sight disorder. Perver- it's the name. I can't remember it clearly. It is called a name like that, peripheral sight compulsive disorder. It is a So at that time, I feel so relieved because it has a name. So it's not, I'm not the first person, and I'm not the only person who got this condition. And it has a name. So that means the psychological doctor, psychology, the doctor named this condition with a name, and they must have a lot of research and have maybe have a secure method to cure this condition. So I feel so relief at that time, and I talked a little bit more about this condition with AI, about how to cure this condition, how to make a change with myself, and AI mentioned. So AI mentioned this therapy method. Um, it is called Morita method, Morita therapy. It is named after Dr. Shoma Morita, which, who is a very famous Japanese doctor, psychological doctor. And so today this morning I try to find some videos from YouTube about this therapy, and try to read some books about this topic. And I feel quite peaceful in my mind, and not so nervous when that condition um, when that condition happens. So that's two very important sides for this from this therapy method. The first one is try to permit this condition happening, not to press it from happening. Permit this to to see it as a natural condition for any normal person. And the second one is try to do your business. Okay, that happens. My peripheral size focus on something. That's normal. You need to tell yourself that's normal, and you should not be interrupted by this condition. And you need to focus on your um, original task without being interrupted by that condition. So that's a very important aspect of this therapy method. And personally, I practice this method uh, unintentionally, because that must be that must I have to talk about my artery surgery. I talked about it rapidly, but that's the most important fact to push me out of this condition. About 8 months ago, I find my when I was running, I feel very pain. It's a kind of sour pain uh, for my left chest and the left arm, and I feel chest tension and chest press and breath loss. So I went to hospital. Had a I had a CT scan, um, and I found my heart artery was blocked more than 90%. So the doctor put a stent in my artery to open it. That's a very important and very dangerous condition for myself. Um, Without that, I will be dead now. So that's a very, very impactful that is very impactful for my life. So something became loose in my mind. Before that, my world is pretty small. Um, I I focused on myself, focused on my sense, and I lived pretty small. And after that, I felt the boundary in my life. I feel a more large extent of my feeling. It is far more than my previous feeling. It's not about anxious. It's a business of uh, live or death. Uh, that's a it's a more extent boundary of myself. So comparing to that, the actions of my peripheral side focusing on something is much less not so important. So that's a factor pushed myself from this condition. So from about several weeks ago, I find I'm not the center of this universe, and I focused on some religious principle, and I put my burden on much of my burden on the shoulder of the God. So if you are not the center of the universe, you you won't try to control everything because you are not the center of the universe. That's a very important concept for myself. Before that, I try to control everything. I try to control not only every aspect of my life, but everything in my surrounding. So that's a source of my pain. That's a source of my anxious. You will feel yourself with so many feeling, frustrated feeling, and you will feel you are so faded. You are so feel, and that's the source of everything. And when you realize that you are not the very center of your universe, you are just one of millions of people. You are just one of the society. Everything you experienced is just something other people have already experienced. Even so, you feel you are not some special person. You are just one sample of the human being. And even the condition you think this is so special for yourself, it even has a name. That means so many people already experienced this condition. You are not so special, and when you realize that, you feel okay. Everything just so. Everything is just so normal, so not so typical, not so special for you. So when I realize that, I feel so relief, and uh, every anxieties I felt appearance seems so unimportant. And so now I feel so relief, and my condition is not so serious for myself. And if you are some person who who are experiencing this condition, please open your mind and talk with AI. If you don't think you need to, if you feel anxious to talk about this with some doctor, try to use AI to talk about this. Talk to AI. AI knows everything. It is so powerful, and it will lead you towards the previous days, the normal way of your life, and that's what I experienced these days, and I want to share with you in these videos, in this video, and thanks for God. Maybe it's Him opened this window for me, and maybe and sometimes something very bad turns out to be something so sweet. Like my condition, I had this almost heart attack 8 months ago, and it turns out it is the end of my 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 anxiety, my disorder, and it turns myself towards the normal way of my life, and it is my life, and it is my experience. I came here to experience everything, the anxiety and lonely and serious diseases and everything. And I really want to share with you, and also especially for those perfectoristics. I don't know the name. Perspective. If you are perfectoristics, it's very easy for you to get this condition. Try to open your mind, and or maybe you need to spend so long time in this anxiety, and until something very impactful, like like heart attack, impact me and push me out of this condition. That is what I experienced. Thanks for watching, and this is today's video. Thanks for watching.